When you hear the word pregnancy, what is the first thing that comes to your mind? Is it the beautiful bumps, the pregnancy photo shoot, the baby shower, the tiny baby clothes, or maybe you've seen videos online where pregnant women are dancing, glowing, and looking like they are having the best times of their lives? Now, let me ask you another question. How many people have actually sat you down and explained what really happens during pregnancy? Not to scare you, not to discourage you, but to prepare you. As a nurse, I've realized that many women know pregnancy is a beautiful journey, but they don't always understand what is happening inside their bodies or why certain changes occur. Sometimes, because they don't know what's normal, they become frightened. Other times, they ignore warning signs because they just think it's probably part of the pregnancy. That is why today we are talking about pregnancy expectations versus reality. Stay tuned. This is not about saying pregnancy is bad. It isn't. Pregnancy is one of the most amazing things the human body can do. Imagine your body creating a brain, a heart, tiny fingers, tiny toes, lungs, and every other part of a human being. That is incredible. But because your body is doing something incredible, it's also working more harder than usual. This is why many women notice changes they never expect. One of the biggest expectations people have is that every pregnancy is the same. They think pregnancy is the same for everyone. This is one of the biggest myths. Every pregnancy is different. Two sisters can be pregnant at the same time and have completely different experience. A woman can have two pregnancies herself and notice that each ones are different. One pregnancy may cause very little vomiting, while the other one may cause a lot of morning sickness. One pregnancy may feel relatively easy, while the other one much more challenging. That is why comparing pregnancy doesn't help very much. Instead of asking, why am I not like her, it's more helpful to ask, what is normal for my pregnancy and what should I discuss with my healthcare provider? Now let's talk about one of the most common complaints during pregnancy: tiredness. Have you ever heard someone saying, I'm so tired all the time, and another person replies, you are just being lazy? Pregnancy tiredness is not laziness. Right now, I'm talking to both men and women, because most of you men, your wives are going to be pregnant and you think they are lazy all of a sudden. No, pregnancy tiredness is not laziness. During early pregnancy, your body is producing more progesterone, a hormone that helps support the pregnancy. One effect of progesterone is that it can make you feel sleepy. At the same time, your body is adapting in many ways. Your blood volume gradually increases during pregnancy to help support your baby growth. Your heart works harder and your body is building the placenta, which provides oxygen and nutrients to the baby. All this requires energy. So if you are pregnant and you feel more tired than usual, remember that your body is doing important work behind the scene. Thank you. What can help? Try to get enough sleep, rest when you can, drink enough water, and eat balanced meal throughout the day. Gentle physical activity is, if your healthcare provider says appropriate for your pregnancy. It may also improve your energy over time. However, if your tiredness is severe or is accompanied by symptoms of dizziness, fainting, or shortness of breath, don't assume it's just pregnancy. It could be related to conditions such as anemia or another health problem. So it's important to get yourself checked. Now let's move to vomiting. Many people call it morning sickness. However, I think whosoever named it is supposed to explain themselves, because for many women, it doesn't only happen in the morning. It happens in the afternoon. It happens in the evening. For some, it comes all day. Morning sickness is thought to be linked to pregnancy hormones, especially in the first trimester. The good news is that for many women, it improves after the first few months, although some continue to experience the vomiting for longer. If you are dealing with vomiting, eat small frequent meal instead of large ones. Small. Stay hydrated and avoid food that smells or food that triggers that symptoms. Some people also find that eating a plain cracker or dry toast before getting out of the bed in the morning helps with the morning sickness. But here is something very important. If you cannot keep any food or fluid down, or you are showing sign of dehydration, such as very dark urine, dizziness, or hardly urinating, you should contact your healthcare provider. Severe pregnancy vomiting in pregnancy can require medical treatment. Don't go and say, I'm pregnant now, that is why I feel this kind of way. Please go for checkup. Let's talk about another expectation. People often say eat for two. Reality is a little different. During pregnancy, your baby needs nutrients, but that doesn't necessarily mean you need to double the amount of food you eat. The focus should be on quality rather than quantity. Choose balanced meal, fruits, vegetable, whole grains, lean protein, healthy fat, and food rich in iron and calcium. Your healthcare provider may also recommend prenatal vitamins, including folic acid, because folic acid taken before pregnancy and during early pregnancy help reduce the risks of certain birth defects affecting the baby's brain and spine. Food safety is important too. Some foods carry higher risk of bacteria or parasite that can be harmful during pregnancy. Depending on where you live, your healthcare provider may advise avoiding food such as raw or undercooked meat, raw seafood, unpasteurized dairy products, and certain high mercury fish. If you're unsure whether a food is safe, ask your healthcare provider rather than guessing. One more thing before we finish this section. Pregnancy can bring a lot of advice from family, friends, and even strangers. Some advice is helpful, some advice is based on tradition. Some advice may no longer match current medical recommendation. It's okay to listen respectively. Yeah. Respectively. But when it comes to decision about your health and your baby's health, make sure your choices are guided by reliable, up-to-date medical advice. Please, biko, ejo. Pregnancy is a journey of learning. The more you understand what is happening in your body, the more confidence you feel and when questions or changes come up. In the next part, we'll talk about common pregnancy myths, medications during pregnancy, warning signs that should never be ignored, and simple lifestyle habit that supports a healthy pregnancy. Please like, share, and subscribe, and drop your opinion in the comment section. Thank you. I love you guys. Mwah.